Hepatitis E is inflammation of the liver caused by infection with the hepatitis E virus. It is a type of viral hepatitis. Hepatitis E has mainly a fecal-oral transmission route that is similar to hepatitis A, although the viruses are unrelated. Hepatitis E can be either acute or chronic. The average incubation period of hepatitis E is 40 days, ranging from 2 to 8 weeks. After a short prodromal phase, symptoms may include jaundice, fatigue, and nausea, though most HEV infections are asymptomatic. The symptomatic phase coincides with elevated hepatic aminotransferase levels. HEV can be clustered genetically into 8 genotypes, and genotypes 3 and 4 tend to be the ones that cause chronic hepatitis in the immunosuppressed. Hepatitis E genotype 1N, to a lesser extent genotype 2, is endemic and can cause outbreaks in Southeast Asia, Northern and Central Africa, India, and Central America. It is spread mainly by the fecal-oral route due to contamination of water supplies or food. Direct person-to-person transmission is uncommon. In contrast to genotypes 1 and 2, genotypes 3 and 4 cause sporadic cases thought to be contracted zoonotically, from direct contact with animals or indirectly from contaminated water or undercooked meat. Like hepatitis A, hepatitis E usually follows an acute and self-limiting course of illness. The condition is temporary and the individual recovers with low death rates in resource-rich areas. However, it can be more severe in pregnant women and people with a weakened immune system, with substantially higher death rates. In pregnant women, especially in the third trimester, the disease is more often severe and is associated with a clinical syndrome called fulminant liver failure, with death rates around 20%. In terms of the diagnosis of hepatitis E, only a laboratory blood test that confirms the presence of HEV RNA or IgM antibodies to HEV can be trusted. There is no drug that has established safety and effectiveness for hepatitis E, and there have been no large randomized clinical trials of antiviral drugs. Reviews of existing small studies suggest that ribavirin can be considered effective in immunocompromised people who have developed chronic infection. A preventive vaccine, HEV 239, is approved for use in China. The earliest known epidemic of hepatitis E occurred in 1955 in New Delhi. But the virus was not isolated until 1983 by Russian scientists investigating an outbreak in Afghanistan.